Today we can discuss a topic called OCD or Obsessive Compulsive Disorder. Here, the patient will have uncontrollable recurring thoughts or obsessions and behaviors or compulsions which he or she feels the urge to repeat over and over. These symptoms interfere with all the aspects of life, such as work, school, and also personal relationships. The patient will try to ignore or stop these thoughts or obsessions, but it will only increase the stress and anxiety. As a result, he will be feel driven to perform compulsive acts to try to ease his stress. Most OCD patients recognize that this is an unwanted behavior. Now, what are the signs and symptoms of OCD? Obsessions are recurring thoughts, urges, or mental images that cause anxiety. Compulsions are repetitive behaviors or actions in response to an obsession. Some common obsessions are fear of germs or contamination. As a result, the patient will have a compulsion, that is, he will engage frequently in washing the hands until the skin becomes raw. Some patients may have doubts that they have locked the door or turned off the stove. As a result, they will go on repeatedly checking the doors whether they are locked or repeatedly checking the stove whether it is off. Some patients may have mental images of driving their car into a crowd of people. Some persons may avoid public situations which can trigger obsessions like shaking the hands. Even some patients with OCD may have thoughts of shouting obscenities in public places, so they try to avoid these situations. Some people may have forbidden thoughts involving the sex and religion, so they have to avoid the situations of temples and churches. Some people may have compulsive counting, that is, counting repeatedly. Some persons will do obsessive cleaning, that is, cleaning the house or office repeatedly again and again. Some may have obsessive thoughts of aggression towards others or even self. Some patients may have obsessions of having things in a symmetrical and perfect order. So, they will go on ordering and arranging things in a perfect, precise manner. What may be the possible complications of OCD? The person will have to spend the time excessively for these ritualistic behaviors. This will create problems in work, school, and personal relationships. So, the patient will become depressed and will have suicidal thoughts and behavior. Also, there may be health issues like contact dermatitis due to frequent hand washing. What is the epidemiology of OCD or how common it occurs. Usually, the OCD or obsessive compulsive disorder affects 2 to 3% of the population. Among adolescents, boys are more affected than girls. Among adults, males and females are equally affected. The age of onset of OCD is 20 years, even though it can occur in early childhood as early as 2 years of age. What is the comorbidity of OCD? In other words, which are the mental illnesses seen in association with OCD? The lifetime prevalence of major depressive disorder in OCD patients is around 67%. The lifetime prevalence of social anxiety disorder or social phobia in OCD patients is 25%. Suicide is a major risk factor in OCD patients due to comorbid depression.